In Germany, roughly 6,000 people die as a consequence of traffic accidents each year. 2,500 as a direct result of traumatic brain injury. Year for year, 260,000 patients are admitted to German hospitals for the treatment of craniocerebral trauma. Brain damage is a family affair. In the beginning, 6 weeks after the traffic accident, the doctors told me that it could be that my daughter Heike, who was in a full stage of verbalic syndrome, might be discharged home functionally unchanged if she survived at all. However, they all gave me hope, and I was kept informed about her situation at all times.
Today, increasingly more patients with acute brain lesions will survive thanks to modern medicine. This, however, might be achieved at the expense of severe impairments of higher cerebral functioning. Our patients concerned for early rehabilitation are those with complex impairments of sensory motor and mental cognitive functioning. The level of consciousness might vary between a certain cloudiness to severest unconsciousness and coma.
Relatives are touched emotionally and socially. They cannot come to terms with the catastrophic situation and are worried about the future. They insist on knowing more about the chance of survival and the functional prognosis. The near and dear become partners of the rehab team, and they are included in the day-to-day measures, thus learning how to approach and cope with the new situation. The team will respect the patient's cultural, religious and socio-economic background. Early rehabilitation requires more staff than any other form of rehabilitation. Our staffing requirements are in accordance with the recommendations of the German task force. The classic triad of physical therapy, physiotherapy and occupational therapy constitute the undisputed basis for motor rehabilitation. Neuropsychological, mental cognitive, language, speech and music therapy are becoming ever more critical factors for the patient's final outcome. Social services have the task of psychosocial counselling in economic problems. Electrophysiological diagnostics help to assess impairments and recovery. The basic work is done by intensive care nursing staff. The object of the daily visits is to check the state of the patient's health, documenting the functional impairments as well as any improvements in his condition.
Seine bessere. Ja, zieht sich immer die ganzen Züge aus. So richtig
Even the slightest clinical changes in awareness and motor functions can indicate the progressive recovery of the patient, or else an imminent secondary complication, generally involving the respiratory system, or of an intestinal, urological or neurosurgical nature.
Aufmachen und die Zunge rausstrecken. Ganz weit raus. Die Zunge ganz weit raus. Machen Sie mal die Zunge ganz weit raus. Da ist nichts mehr. Nee. Da ist er raus. Ja, auf Wiedersehen. Gute Besserung.
Polytrauma.
Intracranial mass lesions and hydrocephalus cause typical neurological and mental cognitive impairments. Respiratory complications and bronchopneumonia are frequent due to swallowing disorders and silent aspiration.
Our department was designed for early rehabilitation of 20 adults who suffer from acute brain damage. This kind of rehabilitative treatment needs a specialized staff of 45 people. All rooms are located next to each other on the same floor within an area of 1,200 square meters. Two main connecting passages guarantees short walking distances for the disabled patients and personnel. The L-shaped intensive care with 1 and 2 bedrooms is directly connected to the special rooms for the rehabilitative interventions, diagnostics, and with the offices of the rehabilitation team. In addition, we have a direct access to the central X-ray department.
Computerized cranial tomography has become the golden standard as an imaging diagnostic procedure.
So, jetzt läuft gleich das Kontrastmittel bei Ihnen ein. Wichtig ist es, dass Sie ruhig ruhig bleiben.
Man sieht jetzt hier sehr schön, das Prüfbar, das ist was für die komplett drin ist. Die Augenäpfel, das kleine.
Thin section tomography, vascular imaging, and spinal CT with bone fenestration reveal potential pathological symptoms in the brain, vascular system, ventricular system, and bone structures, also in the region of the base of the cranium.
Bildakquisition selber, die Einlösung ist dann deutlich verkürzt, aber das Drumherum ist natürlich aufwendiger und anspruchsvoller.
Activating nursing is the fundamental form of therapy in neurosurgical early rehabilitation. With the help of basal simulation by touching and posturing, the patient's perception of his body and motions in connection with personal hygiene and when being dressed is enhanced in the sense of active daily living, ADL, training. These measures include the changing of wound dressings and the laying of gastric tubes, suprapubic urinal catheters, and tracheostoma. Reposturing helps reduce spasticity and enhance the patient's sense of his own body, at the same time promoting local blood circulation. Pressure sores and pathological ossifications of the major joints can be prevented by these measures. All activities and observations are dutifully documented. The recovery of awareness and cognition over time are exemplarily shown in this apalic patient in the following 5 scenes. The rehabilitation management of posturing includes multiple modalities, such as positioning techniques and bringing the patient into an upright and/or a standing position. These measures influence arousal reactions and are a highly intensive central acting stimulus. The unconscious patient is first treated and mobilized with the aid of a tilting bed for standing. Continuous monitoring of vital signs, for instance systemic blood pressure and heart rate, is helpful. Cerebral blood perfusion can be monitored with the aid of transcutaneous near-infrared spectroscopy. Occupational snoozle therapy is new and stands for a combined multisensorial stimulation therapy within a special environment. Snoozle helps to arouse and to calm down agitated patients, with the patient himself positioned on a waterbed and held tight in the arms of the therapist to feel and to enjoy the physical nearness and warmth. Snoozle aims at the stimulation and treatment of perception disorders. The stimuli applied are tactile, proprioceptive, vestibulary, visual acoustic, gustatory and olfactory. Brain damage is frequently associated with an increased muscle tone and resultant spasticity and rigidity. Because of his consciousness impairments, the anxious patient might be agitated. Daily warm baths will help the patient to relax and to decrease spastic movement disorders.
Augen einmal zu. Jawohl.
Without any additional medication, spasticity decreases and the patient will become relaxed, aroused and positively motivated for the rest of the day. The daily exercise of practical day-to-day life habits and activities helps the patient to regain a sense of self and to cope with his environment. Person-to-person devotion is of utmost importance. All therapy stages are explained. The purpose of posturing patients in an upright sitting position when emerging from coma or apallic syndrome is to stimulate arousal and attention. Sitting in an upright position is a strong central stimulus to establish new proprioceptive inputs and to reorganize the vestibular and the central blood pressure control systems.
Jetzt musst du mal die Zähne putzen. Zeig dir mal deinen Mund. Jetzt gleich hinten in den Mund. Das ist dein Mund. Ja? Hier ist die Zahnbürste. Nimm deine rechte Hand.
ADL is performed by occupational therapists in cooperation with nurses, physiotherapists and speech therapists, depending on the nature and severity of the functional impairments involved.
Okay. Hier sind die Schuhe. Ziehen sie wieder aus. Stell sie mal unter das Bett. Jetzt legen wir dich mal über diese Seite wieder ins Bett rein, ja? mal die Beine, ja? So, jetzt entspannen.
The physiological posturing of the patient also plays an important role here.
Kleines bisschen zumindest. Ja? Okay? Ja? Grins. Ja?
The incidence of dysphagia after CCI is in the region of 30%. The majority of patients suffer from delayed or a total absence of swallowing responses, with approximately 1/2 showing reduced tongue control and about 1/3 having reduced pharyngeal transit times, and the rest a reduced laryngeal closure, elevation or spasms. Treatment efforts focus here on compensation mechanisms. Video fluoroscopy has become the gold standard for evaluating patients with dysphagia. This method enables the operator to observe the anatomy and physiology of the swallowing mechanism after the bolus administration of barium-impregnated liquid on its way to the esophagus. The vast majority of patients improve spontaneously. All team members meet in weekly rounds to discuss and assess the patient's individual status. Diagnostic findings are presented with comments on the charts. The performance of sensory motor and cognitive psychological recovery of functioning is assessed by all team members who are in charge of the patient over weeks and months. The functional impairment and fluctuation can be best mirrored with the aid of the Coma Remission Scale score. The maximum score of 24 points on the CRS constitutes the cut-off criterion for ending early rehabilitation. No patient with less than 20 points on day 40 reached a functional outcome of the Glasgow Outcome Scale score 4 or 5. No patient with fewer than 10 points emerged from apalic syndrome within 1 year. Physical therapy is applied to stimulate local sensorial input and at the same time to enhance cortical perfusion and circulation in general. In polytraumatized patients with long bone and pelvic fractures, the use of the fixator externe might hinder nursing and physiotherapeutical interventions. Functional problems after brain damage are typically caused by spastic phenomena embedded within the impaired selective motor control. Patients in coma or with a minimal responsiveness status manifest rigidity as decerebrate or decorticate posturing. Motor control may be affected at many different functional levels, so that patients present with spastic or abnormal extension or flexion positioning of the limbs. The assessment of impairments of the motor system examines the aspects: is the muscle spastic to passive extension? Does the muscle show increased stiffness when stretched? Does the muscle have fixed shortening? Careful treatment depends on clinical patterns of motor dysfunction in order to identify the best method of treating functional problems such as the flexed hip, scissoring thighs, stiff knees, equinovarus foot, bent elbow, pronated forearm, bent wrist, clenched fist, thumb in palm deformity. In addition, pharmacological reduction of spasticity can be achieved by local injections of phenol for peripheral nerve blocks and today by the local application of botulinum toxin. Both techniques are helpful adjuncts to the standard use of casts. Body massage is part of classical physical therapy. focused at relaxing and softening tense muscles of the body and limbs, and at the same time stimulating sensorial perception. Locally, it increases the blood supply to the cutaneous tissue and prevents pressure sores. The risk of local thrombosis is diminished due to the enhanced venous blood backflow. Physical therapy aims at finding strategies to overcome sensory motor impairments. Tremor, clonus and myoclonic and dystonic crises are clinical signs of specific functional lesions of the cortex and subcortical structures of the brainstem and cerebellum. Therapies in the swimming pool are an enormous help in stabilizing the patient's body control and in enabling him to stand and to walk again using the water lift. Notice here the enjoyment this patient derives from the personal attention of the physiotherapist. Transcranial magnetic stimulation of the abductor digiti minimi and electrocortical recordings are fundamental diagnostic tools in early rehabilitation. Electrophysiology helps to follow spontaneous restoration of cortical and subcortical electrical activity, to observe silent electrical fits, and to diagnose peripheral nerve lesions. Putting the patient into a standing apparatus for 10 to 15 minutes helps him to reorganize and to actively train the subcortical autonomous centers for blood pressure, respiration, and heart rate. The benefit of upright positioning is the stimulation of arousal and cognition, and hence the coordination of central motor cortical functions and frontal brain activities. Weakness and paralysis are the most common impairments following CCI.
Sind Sie schon 0,2 Kilometer gefahren?
Active musculoskeletal training helps to improve coordination and muscle strength without exerting a load on the body while riding a bicycle. Daily training enhances cortical plasticity.
Bis zum nächsten Mal. Wiedersehen. Tschüss.
The patient's progress, any complications, and medical decisions are always discussed outside the patient's actual room. The music therapist aims at reaching the awareness of the patient that cannot be accessed through verbal communication. The music therapist improvises vocally to the breathing of the patient, reflecting changes in intensity, tempo, and dynamics. This offers the patient a unique possibility to express his individual self in an expressive musical form. Most of the patients have impairments in alertness and vigilance, problems with memory and learning, and difficulties with abstract reasoning and flexible problem solving. Their capacity to perceive the meaning of ongoing interactions objectively is diminished. The treatment concepts of Luria and of Christensen for neuropsychological therapy during early rehabilitation are applied. The significance of symptoms and signs can be understood only in the context of the functional system. For example, neglect syndrome after intracranial hemorrhage with left-sided hemiparesis. There is no specific treatment of neglect syndrome, but general psychological motivation and ease of mind improve over time. Practically all patients after brain damage suffer from impairments of higher integrated cerebral functions. Mental disabilities are more persistent and constitute a greater handicap than focal neurological signs. The functional system in the brain consists of a number of parts. Each is very specific, particularly the cortical. A preliminary conversation provides information regarding the history, general state, and particular aspects of the patient's mental activity. We tried to provide feedback and to gauge progress and development. And, as demonstrated during the treatment of an aphasic patient after ICH, by lending support and modifying the ambient conditions, it is possible to encourage the patient when we try to guide his attempts at compensation. Functional training with the aid of personal computer programs may be indicated at a certain stage of progress in the restoration of cognition. Self-assessment and feedback is part of the emotional interaction during psychological treatment. Computer training helps in some cases. It is, however, only a poor substitute for person-to-person devotion and attention in the sense of Luria's approach. Music therapy on a two-patient basis and in small groups enhances personal and social integration following individuals' isolation and social withdrawal. Music therapy is based on a neuroscience model of music perception and production, and on the influence of music on functional changes of emotions and perception in the brain.
sind Sie da genau?
Abteilungsleiterin.
Abteilungsleiterin?
Ach, nee, das ist
Dann gehen wir ohne Wechselschicht an. Welche Abteilung? Sie haben geregelte Arbeitszeiten, ne?
Our social worker is the connecting link between the patient's family and hospital affairs,
Normalerweise haben Sie geregelte Arbeitszeiten, aber Sie arbeiten noch.
trying to achieve a good quality of life for the patient and the relatives after discharge from the hospital.
Ja, die Postadresse ist.
Wir beginnen hier mit unserer Frührehabilitation, während der Patient eigentlich noch auf der Intensivstation liegt. Aber wir verlieren nicht aus dem Auge.
The family members and loved ones are partners in the rehab team and are taught how to approach and cope with the new situation.
Das ist nur der Übergang. Und wir stehen ganz am Anfang.
Neurosurgeons and neurologists who are taking care of the acute treatment should be made familiar with the method of early neurorehabilitation. I was able to introduce early neurosurgical rehabilitation into clinical practice in 1994. This treatment aims to support or quicken the course of spontaneous recovery and at the same time to prevent complications. Holistic rehabilitation aims at the patient's social integration based on a multidisciplinary team approach.
Holistic rehabilitation begins with resuscitation of the victim and aims at the patient's social reintegration. It continues throughout the intensive care, operative and conservative management, and chronic long-term treatment. In analogy to the solar spectrum and its characteristic Fraunhofer lines, the spectrum of rehabilitation shows typical phases of specific recovery of each patient. Restoration of impaired functioning and plasticity after acute traumatic and non-traumatic brain damage is substantially influenced by personal and external factors. Early rehabilitation should start already during intensive care and ends when the patient recovered awareness of self and environment to take part in the daily rehabilitative interventions.
Let's look at the functional outcome. 3 years ago, this young lady, a student of chemistry, experienced a severe CCI of the GCS3 category, followed by an apalic syndrome lasting over 9 months. Now she lives on her own in a specially equipped environment for handicapped people.
Man sieht, wie sie das erste Mal auf dem Pferd gesessen hat, gehangen hat praktisch und heute.
Her beloved best friend is her horse from earlier times, when she went for competitions.
Aber sie ist ja das letzte Jahr jedes Wochenende nach Hause gekommen. Und müssen Sie sich vorstellen, dass jedes Wochenende 1000 Kilometer gefahren.
3 times a week she goes for horseback riding. Her teacher says that she has constantly improved her sensomotor, vestibular and cognitive behavioral functioning.
Und auch jetzt in Münster, wenn sie in Münster ist, kommt sie einmal die Woche nach Hause mit diesem ambulanten Pflegedienst. Und auch am Wochenende, sie reitet also 2-3 Mal die Woche reitet. Und das bringt die unheimlich, erstens macht Spaß und auch für die ganze Motorik bringt das unheimlich viel.
Ja.
Ich weiß nicht, wie die Zeit war. Sehr anstrengend. Für mich und für Sie auch.
2 years ago, this gentleman was twice virtually dead because of severe brainstem hemorrhage. He was in coma and mechanically ventilated for 2 weeks and has since gradually recovered thanks to early rehabilitation. Now back in his normal environment, he takes pride in his family, his home, his horses, his leisure time and the beautiful landscape. He enjoys his social reintegration and visits his factory twice a week. a young male nurse takes care of his active daily life and has become the chauffeur for his new Daimler. Although still partly disabled, this man and his family are entirely happy with the functional result and his regained mobility.
The concept of early neurosurgical rehabilitation has demonstrated to improve significantly impaired higher cerebral functioning. It has become a worldwide accepted interface between intensive care medicine and long-term rehabilitation.